So I'm just going to be running through our acne spot injection treatment. I've been performing acne injections for approximately 8 years. I found them to be extremely effective in treating acute acne lesions. And I'm going to talk you through a little bit about the science and how they work. So acne spots are caused by a combination of inflammation and bacteria. So within a lesion, when you get an acne spot, there's tons of inflammation, and that's actually what makes the spot really painful to touch. Steroids naturally are anti-inflammatory. So what we do is we inject the steroid into the spot, and as steroids are anti-inflammatory, there's a quick resolution of that inflammation. The spot feels less painful and it should kind of go down, so to speak, within 24 hours. So there's a quick resolution here, as I've written, 24 hours. And some people have the misconception that this is only really good if you've got like a big event coming up, like a wedding or like a date night. But that's actually untrue, because papers have shown and proven that if you inject the steroid early on in the development of that lesion, there's a much lower risk of acne scar formation. So I've written here, by controlling inflammation early, we're reducing the chance of long-term damage to the skin. And what I mean by that is hyperpigmentation, atrophic scarring, where you get a little dip in the skin post acne. So if you have a lesion and we inject it quickly with steroid, you're less likely to develop hyperpigmentation or an atrophic scar. And over here, we've got a little illustration of how your skin normally is. And then over here, you can see an area which is inflamed. And we inject the lesion directly with steroid. I normally actually inject from two different angles. Over here, we're showing one. So we get excellent coverage. As I said earlier, I've been performing acne injections for about 8 years, and the patient satisfaction rate is very high. So as well as my own personal experience, acne lesion injections have really good scientific backing, and there are some papers which verify its efficacy in reducing the inflammation very quickly. So here are two that I found earlier. One published by the National Institute of Clinical Excellence, and one by Tara Gallagher. NICE provides a comprehensive review of acne vulgaris management. It highlights intralesional corticosteroids as an effective treatment for individual acne lesions, particularly for reducing inflammation and preventing scarring. And that kind of ties into what I was mentioning earlier. There's an effective, really quick resolution, but we're also reducing the risk of post-inflammatory hyperpigmentation and scarring. The procedure itself is actually really easy. I cleanse the skin using a surgical disinfectant. That's really important to make sure that the surface is sterile. I use a micro needle, so the needle's very, very thin. However, despite the needle being quite thin, I'd say the procedure's a little bit stingy. That's because we're injecting into a very inflamed area of the skin. And post-procedure, it's literally just back to normal life. As effective as the treatment is, I do warn patients that there is a risk to the treatment. The main risk is something called an atrophic scar. In normal English, what that means is you get a slight dent into your skin. So if your skin's running along like this, normally there's a little dent. And that actually happens because the steroid can, if you're unlucky, kind of dissolve a little bit of the subcutaneous fat. It's extremely rare, and from my personal experience, it kind of resolves within 9 months. What this kind of indent means is over here, there's another very basic sketch, is where your skin's running along very nice and smoothly. If we've injected here, there's an atrophy of the subcutaneous fat, and that looks like a bit of an indent. It's generally very mild. A 2013 study by Park confirms that while subcutaneous fat atrophy is extremely rare, when it does occur, it's reversible and typically resolves within 6 to 12 months. The study emphasizes that these changes are not permanent and that normal skin texture usually returns within 1 year. And that's very much true with my own real life experience. The 4 patients who have suffered from the indent, within a year, the skin regrows and it looks completely fine. If that does happen to you, we would encourage you to contact us, and I normally inject some saline just to wash the area out. That can accelerate the healing process very nicely. From my personal experience, I've performed without a doubt thousands of these steroid injections. I've had approximately 5 atrophic scars. Why they occurred on those occasions, I'm not quite sure. And, my patients, I would say, probably a little bit unlucky with it. But as a stat, it's very, very low. So as I said, done thousands of these, only happened to 5 patients. And that pretty much sums up everything about spot injections. If you have any further questions, reach out to us. Thanks for watching. And here on screen are a couple of Google reviews from our happy patients who have had steroid injections for their acne lesions.